Hey, this is Paige Smith and Shannon Moore. We're going to be doing our presentation and challenge paper on nursing burnout.
For over a decade now, we've heard in the news that there's been a nursing shortage, and the reasonings include increased demand due to the population aging, other career choices, wages, workload, and work environment. It has been estimated that 500,000 registered nurses in the U.S. are not practicing their profession. 49% of RNs under 30 and 40% of RNs over 30 admitted to experiencing high levels of stress leading to burnout, which they state is the reason they are no longer working as a registered nurse in the hospital setting.
What is nursing burnout? Maslow and Jackson defined it as a syndrome of emotional exhaustion, depersonalization, and reduced personal accomplishment. Emotional exhaustion arises as emotional resources are depleted and nurses feel they are no longer to properly give of themselves on a psychological level. Depersonalization occurs when workers develop negative, cynical attitudes and feelings about the patients they are caring for. Reduced personal accomplishment refers to the tendency to evaluate oneself negatively, particularly in regard to one's work with patients. Burnout may be interpreted negatively as avoidance of professional responsibilities or loss of job interest in a way that leaves the nurse feeling unsupported. Those struggling with nursing burnout may be experiencing the following symptoms: chronic fatigue, irritability, insomnia, headaches, back pain, weight gain, depression, and high blood pressure.
Stress versus burnout. Stress can be characterized by overengagement, your emotions are overreactive, produces urgency and hyperactivity, a loss of energy, leads to anxiety disorders, primary damage is physical, and it may kill you prematurely. Burnout is characterized by disengagement. Your emotions are blunted. It produces helplessness and hopelessness. You have a loss of motivation, ideals, and hope. It leads to detachment and depression. The primary damage is emotional, and it may make life seem not worth living. What's the difference between stress and burnout? Stress goes away when the cause is removed. Burnout does not change when the stressor is removed. Burnout relates to a deep crisis of meaning and purpose of life.
There are 5 stages of burnout. Stage 1 is mental and physical exhaustion. You could have one or either or both. You may feel emotionally empty. You will have little or no desire to relate to your patients or their family, and you will begin to develop physical symptoms as discussed previously, such as chronic fatigue. Stage 2 is indifference, cynical and uncaring, disinterested, and bitterness towards patients and their family. Patients and family become dehumanized. Stage 3 is failure as a professional, not as capable, caring, competent, feeling of helplessness towards clients and family. You may feel alienated or despair of your individual. Stage 4, failure as a person. You'll begin to feel self-hatred, isolation, major impact on family, and you'll start to experience absenteeism from work. Stage 5 is complete burnout. It lacks effect. You no longer you begin to perform your responsibilities without involvement, commitment, or enthusiasm. This is when the nurse will contemplate leaving the profession.
Why are nurses at risk to be burned out? Their job is extremely stressful, resulting in a negative impact on their mental and physical health, efficacy, and productivity. Their job is predominantly emotional, and this factor is considered as a main stress, which can result in a direct intention to leave their profession or continue to stay as a burned-out nurse.
Causes of nursing burnout are understaffing, adjusting to various work shifts, being expected to assume responsibilities for which one is not prepared, increasing severity of patient illness, injury, and inadequate support from supervisors and peers.
Understaffing. It is estimated that it costs $145,000 to replace one nurse. This $145,000 covers marketing expenses, training, signing bonuses, loan repayment programs, administrative functions, and interview time. According to the Journal of American Medical Association, each additional patient per nurse carries a 23% risk of increased burnout and a 15% decrease in job satisfaction. 1 out of 7 hospitals report a 20% vacancy in nursing positions.
Adjusting to various work shifts and assuming responsibilities you are not prepared for. Many times nurses will work 12-hour shifts or longer. Studies have shown that nurses working long shifts are more likely to experience burnout, job dissatisfaction, and patients who are dissatisfied with their care. When long shifts are combined with overtime, shifts that rotate between day and night duty, and consecutive shifts, nurses are at an even higher risk for fatigue and burnout, and this can lead to an increase in poor patient care. The top complaints of patients who have nurses who work 12-hour shifts are poor or no nurse-to-patient communication, lack of pain control, being ignored, and it taking too long for the nurse to respond to their call after they push their nurse call button. 60% of nurses reported being forced to work overtime and float to departments outside of their expertise.
Increased severity of patient illnesses and injury. The life and death decisions that nurses are expected to make on a daily basis play a negative role in the nurse's physical and emotional well-being. One study found that 15% of nurses blame being burned out on moral distress and ethical stress. The long hours spent engaged in the high number of interpersonal relationships and being subjected to high physical and emotional demands leave nurses fatigued, with insufficient energy to cope with stress effectively. Registered nursing is one of the top 10 jobs with the highest level of occupational injury or illness requiring days away from work. The average nurse will miss 7 days from work annually due to injuries on the job. This includes backaches and injuries from improper lifting or moving patients and physical assaults on nurses from patients. 5% of nursing injuries are from assaults from patients they are trying to care for.
Inadequate support from supervisors and peers. Experienced nurses are not always receptive to first-year nurses. These relationships are often categorized as hostile. The hostilities that first-year nurses often experience from senior nurses include rudeness, intimidation, verbal abuse, humiliation in front of others, undue criticism, spreading rumors about them, and undermining, sabotaging, or excluding them. 41% of first-year nurses reported being mistreated by their supervisors, and 54% report being mistreated by senior nurses.
Adverse effects for patients. The Institute of Medicine concluded that the environment in which nurses work is a breeding ground for medical errors which will continue to threaten patient safety until substantially reformed. The IOM points to numerous studies showing that increased infections, bleeding, and cardiac and respiratory failure are associated with inadequate numbers of nurses related to the nursing shortage and/or burnout. For each additional patient over 4 in an RN's workload, the risk of death for hospital patients increased by 7%. Patients of nurses with 8 patients are 31 times more likely to die than those who have nurses with 4 patients. Understaffing and nurse burnout contributed to a quarter of all unanticipated problems that resulted in death or injury to hospitalized patients.
Adverse effects for patients. According to the American Journal of Infection Control, nurse burnout has been linked to higher rates of hospital-acquired infections. Their reasoning is that nurse burnout leads to sloppiness and carelessness. Researchers have found a correlation between burned-out nurses and catheter-acquired urinary tract infections. This is because the burned-out nurse may cut corners and not adhere to sterile measures when inserting the catheter and not properly taking care of the catheter and the bag after insertion. $41 million a year could be saved by hospitals if nursing burnout was reduced, because it costs an average $800 to diagnose and treat a catheter-acquired urinary tract infection.
Nurses who work long shifts and overtime are also at a higher risk of cardiovascular disease. Nurses who average 3 to 4 hours of overtime per day are 1.6 times more likely to develop cardiovascular disease.
Preventing or reversing nursing burnout, you have to learn to say no. You have to manage and lead a healthy lifestyle, and you have to learn to manage stress effectively.
There is a 22-item scale on burnout that nurses can take to see where they fall on the burnout scale, and some hospitals use this questionnaire or one similar to it in determining the likelihood of a nurse developing burnout or to determine if a nurse is currently experiencing burnout. You can do this at your own leisure on your own time.